This is Dr. David Albert from the Digital Health Summit at CES 2020, and it's my pleasure to speak with Laurie Orlov, who is an industry analyst, and Home Watch Networks is her organization. And today I want to ask her about voice technology. We have it in our homes, Alexa, Google Home, and how it's impacting healthcare in general and digital health specifically. Laurie, take it away.
Well, we're in a very exciting period of the evolution of voice technology in healthcare. Voice technology has really made its impact on us only for the past 3 years, and it's really only entered the healthcare world for the past 2 years, starting with pilots at Children's Hospital in Boston and Mayo Clinic, presenting voice skills that people could access in their home to get advice about first aid, how to solve a certain problem they might have physically, and where the nearest urgent care center was, or hospital. But it's moving far past that. We're in a really exciting stage now where people are beginning to use it to consider offering discharge instructions for people as they leave the hospital, for doctors to speak their notes as they're at the patient bedside, as opposed to having to wait later and typing them into a computer system, for filling a prescription. So in your home, you can actually say, fill my prescription at a particular pharmacy. And voice techniques are being developed both for health and wellness in the home, but also for using your voice as a biomarker, as a way of indicating that you may have some kind of illness that might otherwise not be able to be easily detected. So that's what's happening.
Well, I know that whether it's depression, there are people who have shown that they can pick up depression, or having a wife and a son who are both practicing physicians, they would love to be unburdened by having voice-activated scribes.
Right.
But you know, Alexa and Google Home, they're in all kinds of devices today, watches, cars, and so obviously this will expand the reach of voice enablement to anywhere, anytime, and obviously in an emergent situation, being able to say, you know, Alexa, call 911, tell them where I am, that could be very powerful. So you see this from an industry perspective as obviously growing strongly over the next few years?
Yes, it's sized, the voice market in general is sized to be a $49 billion market within the next few years. But specifically in healthcare, people are starting to see the possibilities and the idea that you could actually, not just Alexa, but that you could use a wide variety of interfaces. So you could have a Google Assistant on your phone, you could have an Alexa interface, but many other players are getting into it. Microsoft and Samsung are all looking at what they can do to basically create a
Let's
platform.
not forget Apple.
Oh, and did I mention Apple? Let's not forget Apple, to provide a platform upon which to expand voice-enabled technology for consumers and healthcare providers.
Yeah, I mean, earlier today I had a woman in charge at the Mayo Clinic, physician Dr. Prita, talk about the pilots they're doing and bringing all that incredible content that Mayo Clinic has, validated healthcare content, to Alexa, to Google Assistant. And so it is an exciting time, and I certainly look forward to seeing how the continued interaction of the consumer electronic industry and healthcare. We mentioned consumer companies, not healthcare companies.
Right.
And I think the distinction is blurring.
Well, I think people don't necessarily trust the consumer device companies as much as they're going to trust their healthcare providers. And so some of the latest capabilities are coming from trusted sources, and will not only help physicians, help patients, help nurses, but make the care more proactive. And we will be at a point not too long from now where the devices will speak up in a proactive way and say, did you take your medication? It's 4 o'clock.
Well, that's exciting. Again, thank you, Laurie. This is Dr. David Albert from the Digital Health Summit at CES 2020.